Good morning, Commissioner Berry. Good morning, Norm.
Yeah, good morning, Roger.
Chairman, it's 10:30. If whenever you're ready, we're ready to go here.
I'm ready as well, Chairman Boyd.
Okay, Denisha, would you do a roll call, please?
Yes. Norman Boyd,
Here.
Elena Cummings,
Here.
Kenneth Davis, Kenneth Davis, Russ Childers,
Here.
Roger Folsom,
Here.
Anthony Williamson, Anthony Williamson,
Here.
thank you. Mark Trail,
Present.
Russell Crutchfield, Russell Crutchfield, David Cruz.
Here.
And just for one last time, I'll call again. Kenneth Davis, Russell Crutchfield. That concludes my roll call, Chairman.
Thank you, Denisha. We did have a quorum to conduct business. I believe we have 7 board members. Thank you all so much for joining us this morning. And Commissioner, we have our board meeting today. It will concentrate on the budget. But first of all, I'll call the meeting to order and ask that Commissioner Berry give his report, please.
Good morning, Mr. Chairman and members of the board. Thank you very much.
Commissioner, I'm having a very hard time hearing you. Is there a sound issue?
Is that better?
That's a little better.
What about that?
Yeah, that's better.
Okay. Good morning, and thank you very much for being with us today. A couple of just brief updates. One, you'll hear from Lisa about the budget. Budget instructions this year were to be as close to a flat budget as possible. While there were no reductions, we're getting some feedback here, directed, it was a flat. Great job preparing the department for the budget submission, and I think you'll be pleased with what you hear from her. Before she gets into that, though, I did again want to recognize our frontline workers in all of our hospitals across the state of Georgia, including those hospitals from the Department of Behavioral Health and Developmental Disability, corrections facilities, all whose frontline workers are really doing an incredible job of keeping the residents and the consumers and the patients that we're serving safe. So I certainly want to recognize them, along with our partners with the Georgia Hospital Association and their phenomenal leadership, nursing home associations and long-term care facilities who are fighting this battle every day. We can't thank you enough for your partnership as we continue to address both federal and state regulations that are coming out and needing to get information out to those facilities. So thank you. I think the other big news is that we continue to provide a tremendous number of clinical staff through our partnership with HWL Healthcare. Joe Hood has been leading that initiative along with members from the governor's staff to make certain that as hospitals and long-term care facilities have staff that have either been out with the illness or due to family-related issues are not able to come to work. We've been providing now close to, I believe it's almost 1,500 staff across the state in a combination of both hospital settings and long-term care facilities. Joe has done a remarkable job of helping coordinate that, along with several other members of our team. Sean Walker has played a nice role in helping with keeping up with that, and many others. The work continues, as I've shared before. We have people that are both coming into the office periodically, but more importantly, just working more than we ever could have imagined remotely. And that has been just remarkable to see the level of customer service that has continued to be provided by our department. I'm really proud of people for what they've done. A couple of people come to mind: Brian Dowd, Catherine Ivy from the Medicaid division, Jeff Rickman and his whole team from the SHBP division. Our Office of Inspector General has not slowed down at all. And of course, Melanie Simon and Elaine Wright from the HFRD area have just done a remarkable job of keeping up with surveys and everything else. So it's been a team approach, and it is truly an honor to work with this dedicated group of public servants, and just want to recognize all of the work that they do. And then finally, recognize the support from the governor's office as we have continued ongoing calls throughout the week where we're keeping in close touch with each other, and that has been very helpful. So, Mr. Chairman, I can answer any questions if anybody has anything. Otherwise, we'll turn it over to Lisa.
Anyone, board members, have any questions or comments for the commissioner? Hearing none, we will move into the main part of the agenda and call on Lisa Walker, our CFO, to give us a presentation on the, I believe the amended 21 budget and the forecasted or fiscal year 22 budget. I remind all of us that if we're not speaking, to please be on mute so that we don't get interference. With that, Lisa, when you're ready, you may proceed.
Thank you. Good morning, Chairman Boyd, Commissioner, and members of the board. I'll be presenting the amended fiscal year 2021 budget request and the fiscal year 22 budget request. But before going into the overview of the presentation today, I just want to give a brief overview of what usually takes place before we bring the budget to you all to present and for approval for submission. Usually our conversations begin in the spring, I would say March, April timeframe, and with the Governor's Office of Planning and Budget, and we have a dialogue with them throughout 3 or 4 months in terms of our various programs at the Department of Community. As a result of those, our conversation with them leads into developing what we call workload numbers that they present to us so that we could submit our budget on September 1. And that's what I'll be presenting today to you all in terms of the budget for the Department of Community Health. I'll begin by going over a brief agenda. The agenda that I'm going to cover today will cover some of the fiscal year 2020 budget highlights, and also our fiscal 2021 current budget, and then we'll go into the budget request, and I'll also give you a financial status of the state health benefits plan. Beginning with the fiscal year highlights for the Department of Community Health for 2020, I start by giving you an overview of the Georgia beneficiaries of the various DCH programs, specialized benefits programs. And usually we would cover the Medicaid programs along with the state health benefit. And as you can see in your packet, and for those who are viewing online, 52% of our beneficiaries are in the low-income Medicaid program, followed by state health benefit program, which mainly are state employees, teachers, and non-certificated workers, then age blind and disabled, and then peach care. Looking at that large percentage of the pie that goes to low-income Medicaid, the majority of those beneficiaries are children in our program. 76% are children, followed by low-income caregivers and pregnant women. A total of DCH beneficiaries make up that category of recipients receiving health care. 93% is the percentage that represents that. That's children, pregnant women, disabled, elderly, and SHBP members. Following that update on terms of beneficiaries, in terms of a child enrollment by state, which you would see on the next slide in your packet, Georgia ranks among the top 10 in terms of Medicaid and CHIP, which is our Peach Care, in terms of having a high child enrollment, which is over 1 million. I want to say we have 1.2 million children enrolled in our benefits program within Medicaid. And that is, the state of Georgia is one of the top 10 states in terms of a high number of enrollment as it relates to the Medicaid program. The next slide will give you state funds expenditure in terms of how that correlates in terms of the percentages you saw before, and that will be on the next slide as it relates to low-income Medicaid, age, blind, and disabled. But you will not see SHBP as a part of the pie on this particular slide because state funds are not involved in state health benefit plan. It's all categorized as other funds. As it relates to the state funds expenditure by program, age, blind, and disabled, although it has a smaller beneficiary percentage, it has a larger percentage as it relates to expenditures in terms of state funds related to age and blind and disabled population, followed by the low-income Medicaid, and the remaining percentage is spread throughout our other various offices and administrative program in the Department of Community Health. And that's just a brief overview in terms of how our expenditures are spread throughout our appropriated budget of 16.3 billion, as you see on your particular slide there. The next couple of slides that I'll be going over today will actually be related to our current 2021 budget and how we stand budgetarily, and then go into the request. So for fiscal year 2021 budget, the state funds budgeted by program, and we received a total state funds budget of $16.6 billion in DCH, with 3.7 billion in terms of state expenditures as it relate to 2021. And we say expenditures, but it's related to the budget. And it will still correlate somewhat to fiscal year 2021 in terms of how that is proportioned out budgetarily across the Medicaid programs and across the other offices and departmental administration. 97% of all DCH state funds are budgeted within the benefits program, and that's where the bulk of the expenditures occur, and that's also where the majority of our appropriations are allocated and budgeted. The next slide will be going into our amended fiscal year 2021 budget request. As you heard the commissioner say in the beginning, the budget is flat this year in terms of budget instructions. However, we did not receive any reductions or instructions to reduce our budget. You will be seeing requests as it related to growth in our Medicaid program and some federal initiatives that we would have to cover, and some of the transfers to cover some additional expenditures that occurred, that will be occurring in fiscal year 2021. Starting with the benefits program, and that's age, blind, and disabled, low-income Medicaid, and Peach Care. The benefits growth request this year for Medicaid would be $6,300,992, and that number equates to a sum across all the benefits program. But to give you a more detailed view in terms of the benefits growth and what that looks like, age, blind, and disabled growth would be a reduction of $35,377,067. Low-income Medicaid growth will be $38,561,231 in terms of a growth amount, and Peach Care will be $3,116,828. The reduction will only be in ABD. And as we looked at growth this year, as it relates to some of the federal legislation that had occurred due to the CARES Act, The CARES Act had a provision in terms of maintenance of effort where enrollment is projected, where enrollment, as we looked at it in terms of looking at growth, projected an increase across all three programs during the public health period, just in terms of enrollment. However, the requirement in terms of that federal legislation disallowed disenrollment during the member redetermination period. And although we see a slight enrollment, some of the utilization within that program is lower as it relates to members who continue to defer their elected services such as dental, podiatry, and then it level off in terms of what the remaining of the year will look like in terms of how we looked at it and made assumptions in terms of growth in our conversation with OPB as it relates to our budget request. The next request for the benefits program will be for the dual eligibles. And it will be a preliminary Medicare Part D clawback in the amount of a reduction of $7,082,476. And that reduction really correlates to the enhanced FMAP that came as a part of the CARES Act legislation. We had an enhanced FMAP of 6.2. So it will be a reduction of the state funds to support Part D clawback, which is the prescription part of the dual eligibles that we pay for, the prescription premium that we pay for. The next item will be the preliminary Medicare Part B premium. And the Medicare Part B premium is the part of the medical coverage that we pay on behalf of the dual eligibles that you see. And that will be an increase of $2,210,621. The current rate for the Part B premium is $144.60, but starting calendar year 2021, that will go up to $153.30. And the amount you see that we're requesting is to help fund the additional increase related to that premium. The next item is a reduction in our budget as it relates to increased FMAP. As you heard me previously state, the increased FMAP that received as a part of the Coronavirus Relief Fund, it had an enhanced FMAP of 6.2%. And this enhanced FMAP will be used as a reduction in terms of submission to OPB, and that reduction will be $162,714,405. And this is for the period of September through December. I'm not sure if you can recall, but part of our reduction in our previous submission to OPB for 2021 was a reduction for July through September that we had previously offered up with the 11% reduction. This is a further reduction in terms of that enhanced FMAP for the period of September through December of 2020. The next item that you see is Indigent Care Trust Fund. And this is for the private deemed and non-deemed hospitals to support the disproportionate share hospitals in terms of the privates. And we have to have a state appropriation as it relates to federal drawdown to support the disproportionate share hospitals, and that request is for the amount of $35,745,727. And this is usually in the amended budget because we always have to true up the number. So you always see this request or this ask in the amended year budget. The next item is a transfer. And this is a transfer from the Age, Blind, and Disabled program to the Departmental Administration program. In 2020, we saw an increase in independent lab cost in the Medicaid benefits program. And we work with the policy side. There was an initiation of a prior authorization for further independent lab to be utilized. So in order to help fund the independent lab prior authorization, it's a transfer of $850,000 from the Age, Blind, and Disabled benefits program to Departmental Administration to help offset the increased costs with doing the prior authorization for those independent labs. The next item is for healthcare facility regulations, and that is a transfer of $2,448,000 from benefits to healthcare facility regulation. and that is from Age Blind and Disabled program also. And this is to help fund the CMS COVID-19 mandate for infection surveys that the surveyors go out and do in the nursing home. And this is to help cover the additional costs that it would take for the surveyors to complete those surveys for that particular mandate that CMS initiated this past summer. That concludes the amended year 2020 budget request. And I'll pause if there's any questions as it relate to the amended 2021 budget request before going into the fiscal year 2022 budget request. If there's not any questions as it relate to that, I'll go into the fiscal 2022 budget request. And you'll see some of the similar items that you saw in the amended year also, but you'll see some new items that I will go over in terms of explaining what those are. Once again, benefits growth for the Medicaid program. This is Age Blind and Disabled, Low Income Medicaid, and the Peach Care program. It's a total request of $106,462,177 request, but that is broken down in detail based on each Medicaid benefits program. And it will be a reduction in Age Blind and Disabled of $24,081,642. It will be an increase in terms of growth in low-income Medicaid of $125,949,498. And it also be an increase in terms of growth in Peach Care of $4,594,321. And we base these assumptions on a return to a level of growth seen before COVID-19 based on current information that we had to look at in terms of forecasting what growth might be in terms of 2022. Overall enrollment is assumed to be mostly flat as determination starts at the end of the public health emergency period. And we currently assume that redetermination will start again in January of 2021. Low-income Medicaid enrollment is projected to grow while we see a slight decline as it relates to ABD, and we also assume an uptick in terms of utilization will reoccur in 2022. These assumptions are predicated on the public health emergency no longer being in effect and utilization going back to the pre-COVID trends as in 2022, as we saw before COVID started in March. The next request is a restoration item. This is restoring the FMAP decrease that was in our fiscal year 2021 budget that occurred on July 1, 2020 of this year. And that's an increase of $165,425,810 million in terms of restoration of what that FMAP will be. The next item is also a restoration. We also presented in our previous budget for 2021 a decrease in terms of risk corridors that were being implemented for the CMOs as that we saw utilization going down. And that request is restoration is $102,194,683, and that's restoring that funding level back to the what we had originally had before the risk corridors were in place. The next item is a replace of tobacco revenue with State General, and this is just a fund source swap that we had a discussion with OPB about in terms of tobacco funds coming into the state, and that is replacing tobacco funds with state funds of $50 million. Once again, you will see the Medicare Part B premium, and that's Medicare Part B that we put premiums that we pay on behalf of dual eligibles. And that is a request of $7,570,360 as it relates to that share that we will have to support in terms of Part B premiums. And that will be in calendar year 2022, and the rate will go up to $157.70 in terms of what that part of the premium will be, moving from the $153.30 you had heard me state earlier. The next item is the preliminary Medicare Part D clawback, and that's what the premium we pay on behalf of prescription drugs in terms of the dual eligibles. And this will be for calendar year 2022. And the rates for calendar year 22 has not been published, but the request for Part D clawback will be $4,924,023 as it relate to the prescription premium that we have of the dual eligibles. The next item is reduced funds for the health insurer fee moratorium. For our 2021 budget, we received an appropriation of $38,545,835, and this is to go back and recoup that in terms of a reduction because of the moratorium. There is a moratorium going forward that we would not have to provide that fee for those providers, and that will be the CMOs as we consider the providers to be. The next item is a similar item that you saw in the amended fiscal year budget, and this is transfer of $850,000 from the benefits program to administration to continue the prior authorization for the independent labs. So that you will see as a yes item to have that as a permanent change to our base budget. You will not see the healthcare facility regulation transfer because that just was a one-time transfer to make sure those surveys are conducted and done in the current year. That concludes the budget request for our Medicaid benefits programs in our other offices that we will have to have support for operation in. And I'll pause once again for if there are questions. If not, I'll go forward to give you an overview of the State Health Benefit Plan financial update.
Lisa, this is Denisha. If you could.
David Cruz. I thought I heard you in the benefit growth number of the 106 million that you said there was a decrease in age blind and disabled inside that. Is that correct?
Yes, sir. It was a decrease of $24,081,642.
And what drives that decrease?
We project and we assume a lower enrollment in terms of ABD as we see the benefits going forward, and that's what's contributed to the age blind and disabled. And one thing I want to point out, Mr. Cruz, and this is our base budget for fiscal year 2022. We continue to monitor, and if anything changes in our program, we make adjustments in the amended year as it relates to that.
Okay, thank you.
Mm-hmm. And Denisha, you were getting ready to make a statement?
Yes, Ms. Walker, if you could wait just one moment. We need to make sure that Chairman Boyd is unmuted as well as Mark Trell. Mr. Trell had a question.
Okay.
Okay, can you hear me now?
Yes.
Okay. Yes, Ms. Walker, apologies, we were muted. Going back to amended 21, I just wanted to ask a general question. We had earlier, a few months back, taken action on some of the proposed approaches to dealing with the state budget reductions. And I just wanted, since there's really nothing that specifically talks about that in amended 21, I just wondered how we're doing with that. Did those reductions turn out like we planned?
In terms of the reductions that we had offered up in terms of our budget, one was the CMO risk corridor, and we'll have a better outlook as it relates to that the closer to the end of December. Then when we get to December as it relates to the CMOs, where we can go back and see what that utilization looked like in terms of the medical loss ratio. So we'll have a better outlook in December, and I could give you a better update as it relates to that. And the other reduction that that occurred in our budget as it relates to our benefits program was the FMAP reduction, And that will be a restoration to our budget in amended year 2022.
Okay, thank you.
Mhm.
Yeah, this is Norm Boyd. I think I've finally been unmuted, so Lisa, you sorry about that, but it's at what point here are you asking us to vote on the amended budget request, or
No, sir. I was just pausing, giving you all an opportunity to ask questions before getting
Okay.
all the way to the end. And once I do that, at the end of state health benefit, I will ask for an adoption of our budget to be submitted.
Okay, fine. I'm going to mute myself again. Hopefully I don't stay muted. I need to be able to control it myself if the host can allow me. Thank you.
So the next part of the presentation would be the state health benefit plan. And I'll be going over what the state health benefit plan financial status will be in terms of our fiscal year 2020 and projected out for 2021, 2022, and 2023. And that will be on slide 15 of your packet that you have in terms of your board packet. So looking at the state health benefit financial status, the total revenue in terms of 2020 that we ended, and the 2020, it is unaudited at the point it'll be finalized in terms of our audit in November, in terms of what that will be. Our total revenue for 2020 is $3,638,377,077 as you look at that. And you see a baseline expense of $3.4 billion in terms of the expenses. There was a slight decrease in the expenses because of lower utilization that we had saw in terms of the state health benefit plan, and that caused us to have a net surplus of the $228,265,582 in the benefits program in terms of the low income Medicaid, and being projected out in the projected years. You heard Jeff present earlier when he gave a overview of the plan designs that that will occur in terms of an increase in premiums. The increase in premiums, there will be a slight increase of $5 million. That is calculated in our projected numbers for 2021, 2022, and 2023 as it relates to the projected out revenue. And do we see a return of expenditures going back to normal in 2021 and 2022 and 2023? And that's the reason you see an increase starting with 2021 of $3,879,380,000 in 2021. And in 2022, a $4 billion increase, and in 2023, a $4.5 billion increase. However, also in those years projected out, 21 through 23, you see a deficit. And the deficit is that the expenses are going to outpace the revenue at that point. We're projecting that will be the occurrence at that time. And the revenue in terms of coming into the SHBP program, 77% of that revenue comes from the employer share, meaning that 77% comes from state agencies paying on behalf of the employees in terms of the revenue coming in. It's a small portion in terms of employee premiums that support the program versus that employer share of the program. And moving down to the prior fund balance and the reserve fund balance, as you see, we project a slight increase in terms of the prior year fund balance moving up in 2021, but seeing a slight dip in 22 and 23, because we look at it as saying that unless revenue upticks in terms of supporting the program, we will have to use SHBP reserves to help fund the actives in terms of moving forward in terms of supporting the program. But the OPEB will be there and be left there in terms of the OPEB funding as it relates to the prior fund balance that you see. But at this stage, that's a brief overview of the state health benefit financial status. And at this point in time, I'm going to pause if there's questions related to SHBP.
Are there any
Uh,
questions or comments from the board?
Yes, Ms. Walker, just for clarity, are you saying that the prior fund balance is the same as the OPEB reserve?
The prior year fund balance is a combination of the OPEB reserve and the SHBP reserve. And we just combine it into one, but we can break it out and provide you all if you want to see what's the SHBP fund balance versus the OPEB fund balance.
I don't know that that's necessary at this point. I just was getting clarity, but thank you.
Mhm.
Any other questions or comments from the board, please? Hearing none, Lisa, you may proceed.
Well, Chairman Boyd, if there's no questions, I want to just ask for the favorable adoption of our budget for it to be submitted to the Governor's Office of Planning and Budget on September 1, 2020 of this year.
Is there a motion for approval?
This is Trail. I'll so move.
Is there a second?
This is Folsom, I'll second.
Motion's been made for approval and seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Lisa, thank you so much. Please proceed.
Okay, and that concludes our presentation, Chairman Boyd, in terms of our budget for amended fiscal year 2021 and for our fiscal year 22 budget. And that concludes the presentation.
Okay. Is there any other business to come before the board today? No new business. I'd like to add thanks on behalf of the board, as the commissioner talked about earlier, our appreciation for the fine work and difficult work that is going on with our first responders and the people within DCH. And hopefully we get back to more normal things and we can actually have an in-person meeting here one day soon. With that, I will call the meeting adjourned. And our next meeting is September 10th. So you will be getting information on that. And again, thank all the board members for taking their time today. Thank you.